My name is Michael Chehval. I'm a urologist. My practice is at St. John's Mercy Medical Center, and I'm also a clinical professor of urology at St. Louis University. We wanted to spend a few minutes here talking about urinary incontinence, which is a problem that affects women somewhat more than men. There's two types of urinary leakage or urinary incontinence that can affect women, and this is not necessarily a disease of older women. The first type is urinary urgency and urge incontinence, or a situation where a person just doesn't have enough warning time to get to the bathroom before they begin to leak urine. The second situation is urinary stress incontinence, which occurs when there is stress, especially on the abdomen, stress with either rising out of a sitting position, coughing, sneezing, possibly even running or lifting. Urinary urge incontinence is a situation of bladder irritability, where the bladder just doesn't store urine well. The person gets an urge to void, and the bladder is going to behave without or empty itself without permission of its owner. And in that circumstance, the bladder generally empties itself more or less completely. So there's a great deal more urine or more wetness. The second situation is urinary stress incontinence, which is a little more common in women. It's more common in women who have had vaginal deliveries, and the bladder loses some of its support because the bladder has dropped slightly. There is incompetence of the external sphincter, and with stress, the sphincter can't hold urine, and there will be some squirts or dribbles of urine. The urge incontinence situation doesn't generally respond to surgical procedures, but does respond to medications. And there's been a real expansion in the number of medications that are presently being used for this situation, and they're quite good. Urinary stress incontinence generally doesn't respond to medication, but does respond to an operative procedure, primarily an operative procedure to lift the bladder out of the vagina and restore the competence of the sphincter. There are times that women have both urge and stress incontinence and will need both an operative procedure and medication to achieve total dryness. But it's very important to make the differentiation, because if you do an operative procedure for urgency or urge incontinence, those people are not helped and could get worse. If you do operative procedure for not for stress incontinence, but for the other form of incontinence, those people are not helped by the procedure, and in fact can be made a little worse. So it's very important to differentiate the two, and very often a history and discussing the situation with the patient, with the lady, will differentiate the two types of incontinence.